Let's start.
Okay. Thank you.
This is the patient case study and, taken by Nandana. According to this case history, okay. So, kidney is a hypo, and liver is hyper, and fire is hyper,
இதை மட்டும் பிரிண்ட் அவுட் எடுக்க முடியுமா?
and
முடியல.
spleen is hypo,
Kidney stone.
lungs are hyper. So here you did not mention that what is the complaint of patient.
Complaint is bleeding piles and mainly he has bleeding piles, then muscle pain, then fertility issue, the hair fall is there,
Bleeding piles,
bleeding
muscular-
piles, then constipation, then
muscular pain,
muscular pain is there, then frozen shoulder comes very frequently, then he likes sweet a lot, too much liking for sweet. Hair fall is another issue, then fertility is also. Then likes singing, listening to songs always, 24 hours, even if you put songs, you'll be listening. Then dislikes bitter taste, she doesn't eat bitter taste. These are the symptoms. So, based on things I found that spleen is the primary organ because most of her body aching, everything is related to muscle related movement. So I kept it, so that needs to be addressed. So we go to secondary and there are 4 organs related to spleen. So 2 are receiving energy, one is receiving energy, one is getting control, and 2 others are
taste craving is sweet.
sweet, yes, 100% sweet. And a little bit barely she
How you
likes,
can say that water is hypo?
water is hypo means she feels always hot in the body, and when urination is there, she feels very like very dry, and the genitals are dry. Dryness in genitals are observed frequently. So based on these symptoms, I found like blue energy or water tea needs single remedy.
Water tea, you can continue.
Yes.
And want to go on single remedy, you can continue water tea. And second medicine, you can give earth tea.
Okay. Okay.
Okay.
Okay. Got it.
This way of preparation is very good and very attractive too.
Oh, yes. This is a you taught
When
us.
you
So it's
when
very
you will
useful.
take the case study and you will make diagrams like this, then patient it will give an impact on your patient that
Yes.
doctor is doing something and he is sketching for me, and the final diagnosis will be good.
Yes.
So patient thinks like that.
I noted the FT also. Thanks, sir. Another patient, I used the template that you have given. I didn't take a printout. I tried to fill the details because she gave it in phone. I found, and you can. I forwarded to you in WhatsApp also, the soft copy.
Francis, did you any work?
Sir, due to some problem here, I was unable to do any work last night. I had a few online classes too, so there was no time for me today and yesterday also. Perhaps after this, also we have one problem now. We are keeping a low profile here in Chennai. We are not calling any patients to our
Pardon?
house. We are not calling any patients to our house.
No need to call any patient. You can take the case study of your wife,
Oh, acha.
and
Okay.
she can take the case study of you.
Yeah, okay. Yeah, because of that, we are keeping low profile nowadays.
No patients are required.
Yesterday you gave the same idea. No? You can do for ourselves. Tomorrow I'll do for myself, and then I'll show it very easy.
And if you don't have any person, you can take my case study.
Okay, all right.
And you can take
Now,
each
oh,
other.
This case study,
We can make a pair, and we can take case study of each other.
okay, fine.
And already Babiji is there, Santa Francis, so you can take the case study.
Acha, theek hai, it's a good idea. I mean, it didn't strike me that I could see she is a big doctor. So I am only now only in the alphabets. So I was not thinking of taking her as for my case study. Yes, definitely she is telling about this kidney stone which she has. Perhaps I can do that. Next class, perhaps I will be able to. Kidney stone, is it hypo or hyper?
Kidney stone is the hypo condition of the kidney.
Okay.
Hyper, no?
Hypo condition.
Hypo condition.
Good evening, sir.
Good evening, Dr.
Good evening, everyone.
Good.
Good evening, Dr. Meena. Long time, yes.
Yeah, good evening, sir.
Welcome.
Dr. Beena, good evening.
Good evening, sir. How are you?
I'm fine, fine. So many days, couldn't see at all.
Yes, sir. I had some engagements at home.
Okay.
Yesterday, Dr. Kumar take this case study of a patient. He make it like this.
Sir, for kidney stone, you said that it is hypo condition. So we can give wood tea and earth as, right, sir?
No.
Ah,
For example, if a patient is kidney stone patient,
ah.
so now we will try to find out that kidney of this person is hypo because of which organ?
Okay.
Or in the hypo condition or in hyper condition. In all the conditions, every organ is balanced by 4 organs.
Yes, yes, yes. Yesterday you explained it very well.
If any organ is disturbed, definitely it will affect on other organs too. Okay. So
Yeah.
for any case, we will treat to the affected organ. Okay. But parallelly, we will find out that which organ is responsible behind this. So, for example, mm,
Okay. Yeah.
your kidney patient example, kidney stone may be due to the liver, may be due to the metal, lungs and large intestine, may be due to the spleen, may be due to the fire or due to the heart. Okay. So simply, if patient is showing me the scan, okay, so no doubt that there is stone in kidney. Okay, so
Yes.
I will give the medicine S6, C6 and below electricity like that for the kidney. But here I will try to find out the cause of this kidney stone. For example, if patient complain that I have taste craving of or means this kidney stone may be because of the liver. If patient says that I have taste craving of sweet, and there are many symptoms related with earth that are showing that patient earth energy is low, spleen energy is low. In that condition, we will treat two positive organ also. Okay. So in this case, if taste craving is sore in kidney patient, taste craving is sore means positive organ is liver. Taste craving is sweet means positive organ is spleen. Spice means positive organ is lungs. So when you consult with patient, okay, first you write the complaint. Complaint is renal stone. But renal stone is not complaint. Complaint may be
Pain in the stomach. Or
abdominal
abdomen.
pain, and burning in urine like that. Okay. But with these symptoms, patient already have a scan and there is a stone in kidney. So patient is kidney stone patient. But after seeing this report, okay, don't start directly write the prescription. Okay, it is the kidney stone and medicine is this and this and this and this. No, no. Just stop. This is the problem. Okay, sir. But check the 5 elements. And try to find out the real cause behind the kidney. Check the emotion, taste craving, and other symptoms too. Then you will get the organ behind the kidney who is disturbing to kidney.
So no ready-made formula. You need to go and do a customized one for each and every
If you
patient.
customize the formula for each and every person, each and every patient, it will be better. No patent formula is applicable in electro-homeopathy.
Okay.
Because all the persons in the universe have different kind of DNA. Have different kind of DNA. Have different kind of this thumb impression. This thumb impression. This thumb is very small, 1 inch size. Okay, and the population of the world is
8 billion.
8 billion.
8 billion.
8 billion.
Yeah.
But this linings are changed. Structure of this thumb is changed. Then how you can give a single remedy for all?
There should not be any blind approach. You should do a systematic way.
Yeah, actually, it is a very easy thing or very difficult. For example, if you have any issue in your computer, okay, it's not working, and you are trying many things, or you tried for 2 or 3 hours, but there is no result, zero, and you are irritating. Sometimes you think that throw this laptop, and I think there is a big issue, and tomorrow I will purchase new laptop. But when I contact to Nanda sir and I explain my problem, sir, this is the problem in my laptop. Okay, just he smiled and told me that please press this key. After pressing this key, within a second, my laptop working normal. What is this? This is the diagnosis. And they know very well about the computer and its software. So they guide. But we are not going in deep and we are not understanding the things and we are not understanding the problem. Sometimes very small problems and we think very big problems. For example, especially in the hyperfunction axis energy of the liver, the main symptoms is heaviness in the chest. Heaviness in the chest. And if the heaviness in the chest, maximum person for the heaviness in the chest are going to cardiologist. And what they are doing? ECG, X-ray, lipid profile, and echo. Total amount is 5,000 rupees. Please pay. Then, if the cardiologist is honest, okay, Then he says, you are normal. Please take this tablet, Pantop D, pantoprazole with domperidone. Okay, 2 rupees medicine after the 5,000 rupees consultation. Hmm? If you understand these things, that heaviness is because of the excess energy of the liver. Simply, if you take the S5 and G in lighter dilution, or you can take any medicine for the control organ or child organ, immediately it will release. When you will give the correct medicine, it will work like a switch. When you switch on the bulb, immediately light up. Bina,
Yes, sir.
ready?
Pardon?
Are you ready?
Ready for what, sir?
Let's talk.
For the diagnosis, the case sheet, sir.
Yes.
Not today, sir. Sometime I'll do it. I'll prepare myself for it. And
So, yesterday we discussed that if organ is positive or organ energy is excess energy, then the excess energy, there is one option is sedate to hyperfunctions organ, and second 25 control organ or child organ. And we give one advice that 25 is always better. Okay. So if you want, you can just directly 25 to control organ and child organ only. Automatically, the hyperfunction of the organ will be controlled. Okay. And second thing, maximum hyperfunction is temporary or acute. In chronic case, there is maximum hypofunction. For example, CRF, chronic renal failure. CRF is a hypo condition. the complication and effects of the chronic renal failure or chronic kidney hypofunction is itching, breathlessness, high BP. These all things are positive or hyper. These all conditions are hyper. But all these conditions are because the hypofunction of the kidney. Why you want to work on itching? Why you want to work on breathlessness? Why you want to work on high BP? Simply, if you work on kidney, if you tonify to kidney, all these symptoms will disappear. So you are not working on this area. You just want to work on this area. And you are trying different medicines and asking to patient if there is any different. Are you relief? Okay. But if there will be a relief, it will be a temporary relief. Because permanently kidney is disturbed, kidney is hypo, patient is in renal failure. By using any medicine, okay, you can't control itching, you can't control breathlessness, or you can't control high BP in this CRF patient. Even in allopathic medicines too. But when you use this medicine for this positive organ, means kidney, and when you tonify to kidney, definitely these all symptoms will disappear.
Sir, previous slide, please.
All cases seems to be easy if we go in this approach. No disease seems to be a major one in this case. All can be dealt very easily.
Pardon?
Most of the cases which they say it's complicated, if you do a systematic study and diagnosis, then we can quickly arrive at a correct medication then in this case.
I'm not getting you, Nandanji.
So what I'm saying is, to do a correct diagnosis, no disease would be a major one. Very easily approachable.
Yes.
The previous slide, sir. I have to write down something at the end part. Slide number 3, sir.
Great.
Excuse me, doctor.
Yes.
Shada, hello. Excuse me.
Yes.
You told now just now about the kidney hypofunction of the kidney. We will be having itching, breathlessness, and high BP. That's 100% correct. Because when the cardiac muscle, which is not the 4 chambers, which is unable to pump the blood, the first left ventricle gets affected. So when the first ventricle gets affected, it affects the right ventricle also. So the blood is not able to move, and it affects the kidney, lungs, liver, all. So when the kidney is affected, no, because then due to that only we get that retention of water, breathlessness will be there. So how to differentiate? Is it because of congestion of heart or congestion of kidney, kidney failure? Because we don't know, we can see the fluid, the water and fluid retention will be on the ankle, on the feet, or something like that. So when we find that edema, so how can we find this is due to kidney or heart?
Pardon, I'm not getting your point.
Repeat. सर जी आपने बोले थे एक किडनी का बोले थे ना, CRF का फेलियर का जैसे हाइपोकार्ब का फंक्शन है, तो उसका इचिंग होता है, ब्रेथलेसनेस होती है, हाई बीपी होती है. So you told to tonify kidney. That's okay. Completely, I agree to that. Because it when the heart is affected, where heart means that the congestion of heart is there, so naturally it affects the kidney also. So when the kidney is affected, it collects all the water and fluid, and it sends to the feet and the leg पर आ जाता है. So जैसा edema हो जाता है, then उसमें भी we can see that breathlessness होती है ना. Heart patients को भी breathlessness होती है. And जब breathlessness होती है तो unless until with a stethoscope we will be able to, we have to find the lung, the function of the lung. Only then we will be able to know whether it is the breathlessness is due to lung or kidney. So कैसे हो सकता है? वो पैर में मोटा हो जाता है ना, edema, swelling.
For example, breathlessness.
Yeah,
Okay,
जी, हाँ जी,
breathlessness is a complaint. Okay,
हाँ जी, हाँ जी,
and this complaint is related to
yes,
lungs. Clear?
yeah, हाँ जी,
But
yes,
here, in 5 element, we will try to find out that this lungs issues is because of liver, because of kidney, because of
not also,
heart, or because of spleen.
yes,
There may be 4 causes.
yes,
Simply, if the PTOT is high, liver is disturbed, definitely there will be a breathlessness.
yes,
Okay. If your kidney is disturbed, definitely there will be breathlessness. If heart is disturbed, there is definitely will be the breathlessness. And spleen is disturbed, there will be definitely breathlessness. So now, how you will treat 2 lungs in the breathlessness, or you declared that this medicine for the breathlessness is P4 or P3? How you can decide or you can declare? If the liver is disturbed, you can't control the breathlessness with this P4 and P3.
no,
If kidney is disturbed, you can't control breathlessness with this medicines. If heart is disturbed, hemoglobin is low, you can't control with this. If spleen is disturbed, you can't control with this formula. Okay.
yeah,
So here in the lungs cases, okay. So breathlessness case, okay, we will try to find out that which organ is hypo. Liver is hypo, kidney is hypo, heart is hypo, and spleen is hypo. And for find out these things, we have already yesterday we discussed that we have some certain symptoms. By using that symptom, we can find out that which organ is disturbed or because of which organs lungs are disturbed. Okay.
yes,
So in that condition, we will treat to that particular organ, which organ is positive organ or which organ is main disturbing organ and which organ is hyperfunction organ. Okay. For example, if a patient come to me and he have the complaint of breathlessness, but he is a known patient of the CKD, chronic kidney disease or chronic renal failure, so immediately I can take an idea that it may be because of this. Okay. Otherwise, I will try to find out.
yes,
Simply, breathlessness is there, blood pressure is high, hemoglobin is low, liver is disturbed, kidney is disturbed. So I will try to find out the cause. So in that condition, I will check. Normally, I will check the symptoms of the patient. Okay. If liver is disturbed, kidney is disturbed, heart disturbed, or spleen is disturbed. And then for the further investigation and further confirmation only, not investigation. For the further confirmation, if my symptom says that patient liver is disturbed, I can check some pathological markers for the liver. I can check the kidney just for confirmation only. But if you have the craving of the salt, definitely 101% your kidney energy is low, your kidney is hypo. There is no doubt. But your pathological tests just only for the confirmation purpose. So if there is breathlessness or if you give P4 or WE medicine, okay, you can get relief, immediate relief for the temporary. But for the permanent treatment relief, you have to find out the cause. Okay,
Yes, sir.
Shastri,
Thank you, sir.
Sir, सुन रहा हूँ sir.
yes, slide. You need this slide. Shastri ji,
Yes sir. Yes sir. Thank you sir.
you was asking for the slide.
Yes sir. Same slide sir.
I'm showing
Thank you,
you
sir.
a patient, my patient treatment. My prescription format. Okay. I'm sharing this statement. This patient is known prostate carcinoma patient. Okay. This patient come on 10th of April. Okay. The chief complaint of the patient was bleeding in urine. Okay. There is blood in urine. This is the chief complaint of the patient. Chief complaint was bleeding in urine and systemic examination. Okay. Skin allergy after Unani medicine. Patient, this disease is 10-year-old disease. Okay. So patient consumes so many therapies and so many medicines for this problem. Okay. And the patient complained me before 2 years when I consume the Unani medicine for that purpose. Okay. Then skin allergy. Okay. And blood clots in urine. The craving was sweet and back pain was there and dislike was spice and frequency of urination and the patient nature is bored and emotion is anger. Okay. So then I diagnose that patient is spleen and water disturbance. Okay. Spleen and water disturb and my screen is visible. My screen is
Yeah,
Yes sir. Yes sir. Yes sir.
you
Yes,
can
sir,
see-
we can see your screen, yes.
you can see the treatment. Okay. So for the spleen and water disturbance, I simply give S2F1 and yellow electricity. Candy means 10 drops in 30 ml. Okay. And 25 drops TDS for the patient. Okay. And S6C6 blue electricity, 10 drops in 30 ml. 25 drops thrice a day, and liver spray, local application, and SLAS candy, 25 drops thrice a day, and this treatment was on 10th of April, and now 27th of April. Okay, it is a patient follow-up feedback. Allergy reduce. Allergy reduce. 80% of allergy reduce. Okay, urine frequency reduce. Bleeding reduce. Burning in urine totally disappear, and general condition is good. Okay, so without any medication for the allergy or other symptoms, okay, I use just basic medicine, just give correction in the elements only, and all the complications disappearing. So I mean to say, work on symptoms is not mandatory in electro-homeopathy or in other medical science too. Okay, just to work on cause. My patient, see, okay, you can see any patient or what I am doing and what treatment I am using. We are getting very effective results by using the positive medicine. And we never work on the symptoms. Okay. So yesterday we discussed that if a patient organ is hyper means excess energy. Okay, so try to disperse this energy by using control organ medicine or child organ medicine. Okay, so now today is the turn of hypofunction. Hypofunction. If today Shiv Prasad sir is silent, why?
A bit, I'm attending. I came a bit late, sir.
Madam?
Today I'm late. That's why I'm listening.
If any organ is in hypo condition, then most probably It may be because of mother organ and
First one is mother or son, no, sir?
yes, Shastriji.
First one is mother or son. Correct, sir?
Mother organ.
Mother organ. Okay.
Mother organ. So, for example, if liver is in hypo condition, okay, so it may be because of mother hypo. Mother is not providing enough energy. Okay, and second cause, grandson, because they were also consuming energy with grandson. So if grandson is hypo, in that condition, liver may be hypo. And third condition, control organ. Control organ of the liver is metal lungs. If lungs is hyper means if lungs is hyper and he is consuming more energy from liver or controlling more to liver, so in that condition, liver may be hypo. Okay, and if child organ is consuming more energy, in that condition, liver may be hypo. Okay. So, hypo condition of organ is because of hypofunction of these two organ and hyperfunction of these two organs. Basically, we always prefer to hypofunction. Okay. So if any organ is in hypofunction, we will try to find out that mother is hypo or not. Mother is hypo, then it's good. We will treat to mother. If mother is balanced, no symptoms, then leave to mother. You can consider for the grandchild organ. Okay. You can see the symptoms. you are finding the symptoms or not. Okay. Like that, giving an example. For example, justification. Francis sir,
Yes, sir. Yes, sir.
in your mathematics,
Yes.
after solving the questions, okay, there are few tricks for justification. No? That
Verification.
my answer is okay or not.
Yeah, verification. We call it verification.
Verification.
Yeah,
So
yeah.
patient can, for a student can verify himself.
Yeah, himself. Yes, he can verify whether he can what he has solved is right or wrong. Yes.
If this answer is right, there should be this condition or there should be this thing.
Correct.
Okay.
Correct. Correct.
So
Yes.
like that, okay. First make an idea, make an sketch in mind. Make an sketch in mind. Okay. For example, if the patient is liver hypo patient, okay, just make a sketch in mind. If this patient is hypo patient of the liver, means kidney may be hypo or spleen may be hypo. Okay. For verification, just check the symptoms. Okay. If both things are normal, means as per your idea or as per your thought, if there is the same symptom, okay, then the disease or organ is verified, then simply treat to the organ. And when you will think that this patient is a kidney patient and hypofunction patient, and I thought that this patient mother organ may be hypo, means the kidney may be hypo, and I asked some question to patient for the test craving, you have low back pain or you have fear, like that. I asked some question related to the kidney, and patient says yes, 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 yes. When you verify and if you are correct, then you will feel very happiness that
Yes.
my idea is correct and
Correct. Yes.
these symptoms are correct. And it will be good impact on your patient too.
Correct.
Sometimes patients thought how doctor came to know that I have back pain, I have fear, I have some urine issue. Okay, my test craving is salty. Okay, he know, means this doctor is very intelligent.
Yeah, yeah.
Going in the
Patient
correct
don't
track.
know that doctor is working on 5 elements, but
Correct.
patient thought that doctor is very intelligent.
Going in the correct direction. Justification. We can counter check.
So, for the correct direction, okay, justification is very important. One justifies these things. So
Primary organ, 25 mother primary organ. 25.
Yeah.
Okay, sir. Yes, clear, sir.
In hypofunction or hypo condition, 25 to primary organ and 25 to mother or
Grandchild.
grandchild organ. Okay, you have to select one of them. Okay. And in hyperfunction, set it to primary organ and 25 to control organ or
Child organ.
child organ. Okay, select one of these two organs. Okay, sir.
Okay, yes, clear, sir.
So there are 1, 2, 3, 4, 4 numbers. So in 100%, each number is equal to
25%.
25%.
Correct.
Okay. So in these both condition, how much you are 25? Hmm?
25, 70, no,
25,
75.
75%.
Yes, and sedate only
75% is 25, and
yes.
sedate is only 25%. Okay.
Okay,
And
yeah.
already we try to ignore this 25 too. That's why the consumption of the T medicine is more and S medicine is less.
Oh, now we understand why tea medicine is more. Yes, sir. अभी समझ में आ रहा है कि क्यों टी बहुत ज्यादा है और यस मेडिसिन कम है कंपेयर टू.
Actually, S means क्या है? You are compressing the things. For example, in all the condition, if there is any genuine demand, okay, but any person is shouting for the genuine demand, okay, and you are not resolving the problem, okay, you are just taking pressure and forcefully you are suppressing the voice, okay, keep quiet, you can't speak.
It's a temporary remedy. Just
Like that, you are working with S medicine. You are forcing, don't bark. But if there is force inside the body, if you try to compress, so after a long time, you can see the symptoms in other way, in other organs, in other problems, in other things. Getting my point?
Yes, sir.
So if there is a problem, or if any person is shouting and demanding, okay, just give a solution. Not suppress the things. Sedation is not a solution. And tonification is a solution. For example, one more example I am showing you. You listen the story of monkey and cat.
What is that?
You listen the story of monkey and cat for balancing.
Ah, yes, yes, yes.
Same thing, monkey, cunning,
Hmm?
cunning, cat is cunning, monkey is, innocent.
For example, this organ is hyper and this it is the hypo. What you are doing, you are just suppressing this.
Okay.
So if it is suppressed, then after some time, automatically
It gets balanced.
it will be disbalanced. Okay. But if you tonify this, so it will balance naturally.
Okay.
Hmm?
Correct, correct.
What monkey was doing? Monkey was taking some piece of bread from this side and taking some piece of bread from this side.
Ah,
If lungs is hyper, you suppress. Said it. After few days, you will see the results on this kidney. Okay, kidney will be hyper. Then you will suppress the kidney. And 1 month later, the lungs will be hyper again. Then you will suppress your lungs. After 2 or 3 months, there will be a new complications or new things or new disease. Yes, sir?
Given best example, sir.
Finally, plate will be empty if you keep on reducing. At the end, the patient will go off.
Yes. Yeah. So finally, there are 2 combinations for every disease. One for the primary organ, maybe the tonification and sedation, and second one should be always tonification. There is no change in the second composition. Second organ should be always tonification. Find out the deficient organ and tonify it. So, do you have any questions?
No,
Regarding today class?
I got it. Because today, this example also you said to 25 both. I know which are both hypo. I got the logic and exactly it's matching with your concept. Yes, I got the principle now.
ಇದು ಅರ್ಥವಾಯ್ತಾ?
Sir, can I ask you a question, sir? For urine retention, Hello, sir. Huda, sir.
He's 77 now.
Huda, sir. Do you
Yes.
hear me? For urine retention,
Urine.
retention.
Okay.
77-year-old S2C17 दे
Verb one.
सकते हैं. Verb 1.
No,
Okay.
nothing. Don't go on this things.
Okay.
Just for the urine retention. For the urine retention, simply urine retention is the issue of kidney.
Yeah.
Yes, yes.
ठीक है?
Yes, sir.
Kidney hypo.
Okay.
Okay. Then find out the second organ.
Oh.
Check the 5 element. Okay.
Okay.
So for the kidney hypo, you can give C17, S6 and blue electricity. Okay. If urine retention is because of the kidney. Okay. If urine retention is because of the bladder, for example, kidney is working and bladder is full of urine. Okay. But it is not passing.
Yeah.
Then you can give the medicine C17, S2 and blue electricity. Okay. But these medicines are only for the first organ.
These are all first organ, right?
Yeah. But what is the second organ? Positive organ, main organ, root organ. Find out in the two organ. One is mother organ. Mother organ of the kidney is lungs
Bladder.
and large intestine. Is there issue in lungs and large intestine?
Yes, lungs में है.
Find out.
लंग में है, लंग में है.
She's asthmatic patient.
And secondly, find out is there any issue in heart or small intestine. To find out where is the problem, in lungs or in heart.
I think it is the lung.
Because she is
So if
asthmatic.
it is in lungs, just start with S10, P3 and WA as second medicine.
Second medicine F10, B3.
Yes. Yes.
S10, P3 and WA. 10 drops in 30 ml. It is a strong for 25.
Oh.
And C13, S6 blue electricity, 10 drop in 30 ml. Strong. Okay.
Okay.
Customize the formula for each and every patient. Okay. No formulation is fixed.
Correct, correct. Depends upon the mother organ and the
Yes.
other organ. Yes, child organ. अगर ये पेशेंट नेबुलाइजर भी यूज करती हैं occasionally,
क्या?
अगर ये पेशेंट जो जिसके बारे में हम बात कर रहे हैं, अगर ये पेशेंट नेबुलाइजर भी यूज करती है occasionally, बराबर नहीं है, कभी कभी, तो ये क्या होगा?
इसका नेबुलाइजेशन भी ठीक हो जाएगा.
ओके, इसी से ठीक हो जाएगा, राइट?
इससे ठीक हो जाएगा.
तो नेबुलाइजर में P4 डालेंगे सर जी, उनको बोल दें.
नेबुलाइजेशन में कुछ नहीं डालना है आपको, तो ओरल मेडिसिन जो चलानी है वही ओरल मेडिसिन देना है.
No, but she is taking the medicine which is prescribed by doctor. She is having at home itself with the nebulizer.
So continue for that medicine, no problem.
Okay.
But when you give this electro-homeopathic medicine, slowly it will be taper.
Okay.
Okay.
Yes, Nandan sir.
I Just learning this 5 electricities and hypo and hyper of the 5 elements. I'm not well versed with the other terminologies like S1, C6, all these things actually I had to learn. So I'll not ask any questions now. We'll be covering the chapter later. I'll learn.
Yeah, actually, you are not aware about these electro-homeopathic medicines,
Yes.
and we prepare 10 medicines for you people who are not aware about the electro-homeopathic. Okay.
Yeah.
So these 10 medicines are good tea,
Yes.
fire tea,
Earth tea, metal tea, and then water tea.
metal tea, and
Same way, the yes one.
same way S. Good S,
I know only these 10.
fire S, earth S, metal S, and water S. Okay.
Yeah.
Next class, when we will start the next class, you
Okay, I know.
will teach about the electro-homeopathy. Yeah? That is a separate class and different class. This
Okay.
class is only for 5 elements.
5 elements. Okay.
Yes.
The persons who are already aware about the electro-homeopathy and how they use electro-homeopathy according to 5 elements. So, this thing.
But already I have all the kit I purchased from Giridhar Gopal. I have the kit with. I'm not yet used them. Once I learn, I use them.
No problem. If you have kit, then gradually you can learn. Okay. For example, if you don't know about the driving, okay. But if your son purchase a car, definitely gradually you will learn the driving.
Yeah. Okay.
So if you have kid, and when you will ask the question from me, GG sir and other electronic doctor, and they will advise. So gradually you will be used to, and in the month of most probably in the month of July,
Okay.
we will start a new batch for the electrohomeopathic, basic
Okay.
to advanced.
Right. Thanks.
And in the end of the May, I'm going for Hajj.
End of May, where are you going, sir?
I'm going for Hajj. You know
Yeah,
Hajj?
yeah.
Oh, yeah, Hajj.
Bye bye.
Yes.
Have a
Okay,
nice
okay.
trip. Lifetime trip. You can go and come back. Yes.
Pray for us, sir. Hello,
Yes, sir.
pray for us.
Sure.
Sure. For all mankind and all electro-homeopaths.
Sure, sir. Thank you, sir.
To get wisdom.
Thanks a
Yes.
lot, sir.
I think I will come back the last of June.
Okay, 1 month.
Yeah. We will start next batches and the next classes on
July.
July.
Okay.
That's why I want to complete this class
Quickly.
before leaving India.
Okay. Got it.
By 25th, I'm trying to complete this session. That's why today I take extra session.
Okay.
There are Hajj committees. You need to register in Hajj committee. They will allot you numbers. So a lot of procedures are there.
All the procedures completed.
Over.
Okay. The processes are over. Okay, they and payment and all the things are deposited. Only they will declare the flight date and flight number only.
Okay. Have a nice day.
So I think within 1 or 2 weeks, definitely they will declare my flight number and flight date.
Okay.
All the best, sir. All the best to you for your Hajj.
Next week, I'm planning this class on Thursday and Friday,
Okay.
because Saturday, Sunday, and Monday, I am out of station. Saturday and Sunday I will be at Bangalore, and Monday I will be at Chennai. So I don't want to drop the classes. So it will be better that if we continue on Thursday and Friday,
Same time, sir.
Same time, huh?
same time.
Okay, sir. No problem, sir.
If you want to change the time, I can.
No, this time is very convenient.
It's okay, sir. This is a very good time.
Now I am totally free. Actually, because of Ramzan, I was engaged in some other
Yes.
times. But now tomorrow, now morning to evening, or morning to night, I'm free. Okay, if you want morning time, I can allot morning time. No issue.
Meanwhile, doctor, if you have any list of the 38 with some sort of a notes, you can send. I'll read and keep, but I'll not use it.
Pardon?
We have for the Spagyric 138 kit that the doctor Giridhar gave me. If you have any write-up notes, later you can send me, not urgent.
Yes, sir. I will send you a short note on this 38 medicines.
Okay, thanks.
Sir, I wanted books, sir.
Yes, sir. You want this book? Okay, immediately. I'm sending you this book right now because after disconnecting the class, I will forward.
I am asking continuously, but
I am sending it right now.
okay, sir. 3 books he said,